How do you view AI when it comes to your hospital system? What are the challenges? What are the opportunities?
Yeah, so Frank, what I see as AI, I see it as really the most profound technology in the world today. If you think about it from a healthcare perspective, whether it's helping doctors diagnose disease earlier or helping more people enroll in clinical trials, there's no question that AI can improve healthcare in remarkable ways. And just think about the global picture: 100 million Americans have an undiagnosed chronic disease. 90% of all healthcare costs today go to treat chronic diseases, about $3.7 trillion a year, according to the CDC. AI has the potential to help diagnose disease earlier, help treatments get online quicker, and even address physician burnout. So that's
Okay.
why I am so enthused about AI. Having said that, though, Frank, it's we have to look at it very strategically. We have to be careful how we deploy it. We have to be sure that there are the right governance mechanisms in place to make sure that it's used for the right purposes. So we at Hackensack Meridian have really focused on three areas. One is to really improve clinical outcomes. Number two is to improve efficiency throughout our health network, and three is to give patients educational materials through AI that were not available before.
Got it.
And we put
We're showing
together
your
some.
audience your AI areas of focus right now. I do want to talk about some of the safeguards that you're putting in place.
Yes.
Elon Musk, I don't know if you were watching this at the New York Times Dual Book Summit, talked about some of the challenges and potential dangers when it comes to AI, the fact that AI might be smarter than any person on the world in just a few years. So when you look longer term when it comes to AI, are we looking at a day where AI may make decisions about our health without human input or intervention? How do you move it forward?
I don't see that at all. I think that human input is going to be very important. Human oversight is important. We've piloted with companies to help us on the governance side, Frank. So as an example, Google Cloud, they help us. They provide their expertise, what they've seen around the world in terms of AI governance. We match them up really with our own clinicians, with our operational experts, with our IT folks, to make sure that whatever pilots that we roll out, that there are the safeguards in place. So just to give you a couple examples,
Well,
we
before we
put
get
a
into the
pilot.
examples, I want to ask you about something that
Yeah.
you mentioned just a short time ago, some CDC data. 90% of all healthcare costs, this really amazed me. 90% of all healthcare cost is for chronic diseases and also mental health treatment. So if that's where 90% of the cost is and AI has a chance to reduce doctor workload, I would assume reduce nurse workload as well, does that mean AI is
Yes.
going to
Yes.
reduce the cost of healthcare?
It will absolutely has the potential to reduce the cost of healthcare, and we're seeing it again. As just to give you one example, we're looking at AI in improving our operating room efficiencies as an example. So right now there could be holes in our operating room schedule. Through AI, we can make healthcare more efficient by filling those holes and putting patient operations in place sooner. So patients benefit; they don't have to wait as long, but it makes healthcare more efficient. In the area of imaging, as an example, where it's helping radiologists who really have to read hundreds of images a day. It helps
Okay.
them prioritize those that they need to do quicker. That maybe scans that look like
Got it.
they're positive, and there might be a cancerous mass, as an example.
Got it. So a
They
lot of
can
challenges and a lot of opportunities when it comes to AI.
there are a huge amount, but
Right.
honestly, I mean, my takeaway though is let's not let the challenges get in the way. Let's be optimistic. This has
Okay.
an opportunity to truly transform healthcare.